Hello everyone. Here I would like to discuss about the anatomy of hip bone. So this is the hip bone. It is an irregular bone and it is made up of fusion of three bones, that is ilium, pubis and the ischium. These three bones fuse at this acetabular cavity at the triradiate cartilage. This triradiate cartilage is capital Y shaped and it lies at the acetabular cavity. Here I would like to discuss about the anatomy of ilium. So this expanded part is your ilium. It has two ends. This is the upper end and this is the lower end. It has three borders. First is the anterior border. This is the anterior border extending from anterior superior iliac spine up to the iliopubic eminence. This is the iliopubic eminence. And this is the posterior border extending from posterior superior iliac spine up to the greater sciatic notch. This is the greater sciatic notch and this is the posterior superior iliac spine. Then we have the medial border. This is the medial border. So there are three borders in the ilium and we have three surfaces, that is, first is this medial surface also known as iliac fossa. Second is this sacropelvic surface. This sacropelvic surface has this auricular facet for articulation with the sacrum. And the other one is the lateral surface, or we can say the gluteal surface. This is so called because of the attachment of the gluteal muscles. So on the gluteal surface we have three gluteal lines. First is the posterior gluteal line extending from 5 cm anterior to the posterior superior iliac spine. So this is the posterior superior iliac spine. So from here up to 5 cm anterior to this, we draw this line up to the greater sciatic notch. This is the posterior gluteal line. Then we have anterior gluteal line. It extends from 4 cm behind the anterior superior iliac spine. So this is the anterior superior iliac spine, and 4 cm behind this we have this anterior gluteal line extending up to the mid of upper part of the greater sciatic notch. So this is the upper margin of the greater sciatic notch. At this midpoint of this upper border, we have this anterior gluteal line. Then we have inferior gluteal line extending from anterior inferior iliac spine. This is your anterior inferior iliac spine. So we extend this line up to the greater sciatic notch upper border. This is the apex of the upper border of the greater sciatic notch. This is your inferior gluteal line. So these three gluteal lines, these are on the gluteal surface. Then we have some prominent marks on this ilium. This is your anterior superior iliac spine. Below that we have anterior inferior iliac spine on the anterior border. Then below that we have this iliopubic eminence. Then posteriorly on the posterior border, the interesting features are this posterior superior iliac spine, and below that we have posterior inferior iliac spine. And then we have this greater sciatic notch. So this is the posterior border. Then we come to its anatomical position. For anatomical position, we have to place it in such a way that the anterior superior iliac spine and the pubic tubercle, this is the pubic tubercle on the pubis bone. This is the pubis bone and this is the pubic tubercle. Both these points should be in the same coronal plane. So this is the same coronal plane. They are sharing the same coronal plane in this horizontal view. So this is the anatomical position of this bone. If we put it like this is not the anatomical position, because here the coronal planes are changed. But if I put this bone like this, that is horizontally in this position, then we can say that both the points, that is your anterior superior iliac spine and the pubic tubercle, they are in same plane. So this is the normal anatomical position of this bone. For side determination, we keep this expanded iliac crest at the upper part, the ischial tuberosity posterior inferiorly, and the pubis anteriorly. The acetabular cavity, that is this cup-shaped structure, this faces on the lateral side, and the iliac fossa on the medial side. So you keep this greater sciatic notch in your first VAP space and hold this in anatomical position like this. So we can easily determine the side of this bone. This is the left-sided hip bone. So in the next video, I will be coming up with the muscle attachments on the ilium and the rest of the part of this bone. Thank you so much.